Awesome. Now that the doors are closed, I think that's the signal to start. Well, thank you guys for joining us this morning, last day and early morning. Thank you. My name's Moises Gallegos. I'm one of the clinical assistant professors at Stanford. I'm here with my colleague.
I'm Vitas. I am one of the APDs at Stanford University.
And both of us self-proclaimed, or I guess self-aware nerds in medical education, in the sense that we enjoy looking for different ways of communicating with our learners, our trainees, our patients ultimately too. And so this morning we're going to share with you a little bit about our experiences with graphic medicine, maybe a topic that you are familiar with or have maybe come across in other settings too. And we're just going to share our experiences with graphic medicine. I think both of us from different perspectives of it. And now that we get to work together, we're trying to find ways to work it into what we do. Him on the APD residency side, and I work with the clerkship students when they rotate with us. No financial disclosures. As you guys know, med ed, that's not where the money is necessarily. So to help us get started and be hopefully on the same page, on the same level, what is graphic medicine? I think there's a lot of different definitions out there depending on where you look, but ultimately it comes down to describing the use of comics, which is one of the biggest components, or other imagery to try and convey a story of illness and health. And the combination of words and pictures that develops from that story creates an approachability to the patient's experience. And that approachability is for the patients themselves and how they deal with their illness, but also how the patients can communicate to other people, friends, family about their illness, and even sometimes to allow the healthcare providers to engage in that story with them. So it's the approachability that results from it. I have a 3-year-old daughter, a 5-year-old boy, and as part of their school curriculum, they let us come in as parents to do circle time with them. So if it's the end of the day, they'll have circle time and then they do a story. And in doing it this past year, I realized just how cool it was to do that as kids. And I remember doing that as a little kid. And how now, even as an adult, I really enjoy the power of a good story. So to illustrate my experience with graphic medicine and what I've used it for, which is primarily as a teaching tool, I'm going to tell you guys a story this morning, one that you might relate to. So a few years back, I was working an overnight shift. I'm not a nocturnist, so it was a one-off. Our team had managed to clear out the busy emergency department, and we were feeling pretty good about that. 10 to 15 minutes from sign out, it's pretty calm in the ED, and you feel good. So we were riding that cortisol high, right, to be able to leave. And then there was the familiar tap that goes on the overhead system, and you're cringing inside, and what you hear is the unit clerk say, "Oh, there's a sepsis alert, new patient in room 3. And of course, my heart thinks, all right, well, this is probably not a patient that can wait for the next team, so we should go do something about it. And prep to go see the patient by looking at the chief complaint, and it said fever, fast heart rate, lots of cough. And, I tried to read the book by its story. You're like, oh, this is probably a pneumonia being early in the morning. It's probably a transfer from a skilled nursing facility or other facility. And so already trying to decide in my mind what I'm going to do before sign out. So being good emergency medicine doctors, though, we all know that the patients don't read the book. They don't come in with textbook presentations. And so when you think it might be one thing, it ends up being something else. The story can be complex. The tale can be misleading. And so you gotta dig deeper. And so I begrudgingly, grabbed the stethoscope and walked over, wanted to actually flip through this story a little bit and see what might be going on. And to my surprise, I didn't see the little old lady in the stretcher covered with blankets. What I saw was a very young, healthy looking woman holding a very small baby, a newborn, clearly. So now I'm a little thrown off. And as the patient settles into the stretcher, the nurses hook them up to the monitor, and you can start to see the beeps and the lines come through, and I realized, oh, this patient's actually pretty sick, tachycardic, not looking too comfortable, breathing heavily in front of me, and then the nurse calls out that there's a temp of 104. Start to ask some questions, right? I have to get the history. Never been sick before, doesn't take any medications, actually was doing fine, had an uncomplicated delivery, and then 3 days ago started to feel really heavy palpitations, really heavy feeling in their chest. She started to have some cough and shortness of breath. And when she hit a fever of 103 at home this morning, she figured she probably should come in. And so I start to take it all in, and my mind's seeing all these illness scripts running, things that we've learned, things that I've seen. And it's just not entirely making sense until I see the fib in her story. And I'm not saying that she lied, but I see that the monitor's showing AFib. And as it starts coming together in the depths of my memory somewhere, it starts to make sense. The pieces of the puzzle, the picture comes clearer. I started to realize this was a case of the thyroid storming our emergency department, right? So we're dealing with a case of thyrotoxicosis, probably triggered by the recent delivery of her child. And it was a really neat case. It ended up being very structured, like textbook approach to the thyrotoxicosis. We gave all the meds, but what ultimately came from it was that I created this pictographic representation of my illness script that over the years I've used to teach on thyrotoxicosis. And I've come to refine it from something that was like pencil, pen, and paper to something that's been more colorful using my iPad. And I use it as a reminder of the spectrum of possible presentations to teach with students and residents. And I even go over like the etiology, the pathophysiology of how the trigger to the thyroid storm can happen, how you get that hyperactive production. I even have little characters that I use to talk about the management, right? You got the beta blocker, so the football player there, the thionamide, which is wearing the science lab coat there, and then the little dropper, right? Because I remember very clearly as a resident learning to drop the little iodine in the patient's mouth. And so what's resulted is this nice pictographic representation of what I've come to understand to be like the management of thyrotoxicosis, and I use it over the years to teach with students. I'll text it, email it, airdrop it to them after we get to talk at the bedside, or if it was like a quick, hey, side note of like, this is what you should remember about thyrotoxicosis. So as I've iterated it, it's become a little bit better, and I've got a repository going. I hope to keep adding to it, but using the graphic representations as a teaching tool.
My, I guess, origin story with graphic medicine is a little bit different. I'm not nearly as talented as Moy, and I'm not able to really draw at all. But I guess more from a standpoint of like appreciate it from a literary standpoint and kind of a study standpoint. And so I was never really a comic book kid growing up or a comic book nerd. I actually didn't really even read comics until actually my adult life when I was in medical school. And we read so much in medical school, I stopped reading for enjoyment. And it was really bothering me. And then I came across this guy, Bill Gates' is like 2016 or 2017, like top 5 books to read that year. And one of them actually was this book, The Best We Could Do. And so I picked it up and I was like, oh, this is really cool. And it was my first time ever reading a graphic novel. And I was really actually amazed by the story and how it was the story was told, one, from the author, but also from the artist, and it was like a really impressive story, and I really kind of was able to relate with it. It was kind of this amazing story of like anguish and immigration from a Vietnamese immigrant family in like the 1970s, and I was able to like draw a lot of parallels with my own family's like, immigration script, and so I really enjoyed it, and so it started to purchase these other books and start reading them, and this is like a trilogy actually written by Congressman John Lewis about kind of his time spent with MLK and kind of that whole era of his past, and it was like really phenomenal. And I felt like anybody from a child to me could pick it up and appreciate it, and I just really enjoyed it. And so my wife and I were doing long distance in residency, and so I went to go visit her at UCSF, and of course she was caught late at work, so I decided to grab coffee at this coffee shop just around the corner while I waited for her to finish work, and we were going to go grab dinner. And I come out of the coffee shop and I see this comics book store in San Francisco. And so I'm like, okay, I'll go check it out. And it wasn't actually until then, I go in and, I love bookstores, right? There's all these like things. And then over there I see graphic medicine. I'm like, what is this? Like, tell me more. And I see this whole shelf of just all these books that are graphic novels based on like a medical topic or concept. So I pull one off, and it ends up being this book, and I ended up purchasing it. And it was Epileptic, and it's this really great book. Actually, it's been translated into like 7 languages now. It actually was originally French, but the author goes through this whole story about struggling with his sibling who had epilepsy. And it's a really great story that's kind of drawn in black and white, but in this artful way. And so that's when I first really realized that it was graphic medicine was this genre. And I know you're thinking like, are we really going to be talking about comics today? And it's like, in a way, well, yes, we're going to talk about it. But I hope that like you can see from his example and kind of what we're going to talk about that it's a little bit more than just comics. As Moy kind of mentioned, from a definition standpoint, I think graphic medicine really finds itself at the intersection of comics, art, and medicine. It's a growing field it's becoming increasingly popular, and they help kind of build upon the healthcare narrative in new ways and provide insights into sometimes the patient, the caregiver, or just in general the healthcare experience and the experience of illness. And so I think they're being used more and more as a form of education for the patient, but also even the provider. And so where did it kind of all begin? I mean, using imagery in medicine isn't new, but specifically comics really started in the mid-20th century. There was like some mid-20th century comic strips and comic books that began to kind of touch on medical themes, and it was like works like Mary Worth, Rex Morgan, Dr. Kildare, which were kind of these medical storylines in popular culture, but they were kind of dramatized. And then it wasn't really until the early 2000s that they started to have these couple books that came out. One was Mom's Cancer, which was an autobiographical graphic novel about battling lung cancer. Another one was like Cancer Vixen, which was about someone's experience with breast cancer. And then Epileptic, which is the one I showed you. And then around 2007, the term got coined, graphic medicine term was coined, and since then there's been a lot of works. And really, these are books that are on mental health. These are examples of some different books that depict different like really important times in history, from the AIDS epidemic in New York to the COVID. Also just autobiographical books about doctors who have struggled during their practice, including The Bad Doctor, or a physician who started to struggle with Parkinson's, called My Degeneration. And then here are some that are like more focused on pregnancy and early parenthood. And so there's all these different genres. And so that was kind of my interest and where it started. And I'm always going to kind of talk about some different applications of how we can apply graphic medicine to our practice.
Yeah, and so again, it's sort of like the use of imagery isn't very new, but I think we maybe just don't pay attention to it as much. I always get surprised. I'm like, oh, look, there's actually like a picture going along with it, and then that kind of evokes something in me. So hopefully primed by this talk, or as you think about it, maybe pick up a couple of the graphic novels, you'll start to realize just how much it is actually present around us. So this one, not our image, but borrowed from one of the graphic medicine websites that we'll link to in the QR code, shows about like how the different, again, the array of various types of application. And so hopefully like when you head back to the clinical setting or the teaching space, you'll start to see like, how can I start to pull some of this in? We already use it, right? Infographics for communicating complex topics to patients, being able to put information out there into the community. It's simple imagery too, right? It's not about having it be that extensive drawing. He made the joke of like not being an artist, but it really doesn't come down to like being Monet or Manet. You can be Picasso and it still creates this like intriguing imagery. At Stanford, some of my colleagues use cartoons, like literal cartoons. They make videos out of these graphics to then put these on YouTube, and they're meant to be for the patients, but also communities, and then utilized to teach across countries. So it's actually provided healthcare systems across the globe. And so what really results, I think, and the way that I like to think about it is that the imagery, by using imagery, we expand the language that we have available to us to communicate, whether that be communicate with patients, communicate with trainees, or just communicate like amongst each other as colleagues about like our experiences so far. It even connects medicine with the humanities, right, a little bit better. Allows us to have partnerships. The team that coined graphic medicine in 2007, led by Dr. Ian Williams out of, I think, England, was a coming together of artists, cartoonists, some, I think, English, humanities professors from schools. So it was very collaborative. And while the thought of like using a comic or a cartoon may seem to align better with like a childhood type experience, And and it is used for that even, right? This is a comic book that's provided to kids to help them prep for like what they're going to experience when they go through an MRI, right? Like think about throwing the kid into a 40-minute MRI, so this might help prepare them a little bit. The concept of using this imagery can also help us as adults engage with like things that are uncomfortable, right? So there are topics in medicine that are uncomfortable that get to like the darker sides of society, especially for us in emergency medicine. And so using graphics and a graphic narrative to talk about things like homelessness, for example, can bring a different perspective. It makes it more approachable again. And then, we've all used like Sketchy when we were prepping, right? Taking something that's just like so complex and maybe new and scary in itself and creating something that's a little bit more light, and so adding levity when needed. Now, recognizing that we are at the Society for Academic Emergency Medicine, right? What's the scholarship component to it? We're just going to run through a couple of examples of how it's actually made it into the field of scholarship.
Yeah. So since being kind of recognized in the early 2000s, some scholarship has come out about using graphic medicine. There's actually the first ever textbook for actually like medical students on clinical ethics was recently dropped. And so this is another form of using graphic medicine as a form of education in the classroom for providers. But also people are beginning to publish on it. This is from the AMA Journal of Ethics, talking about graphic medicine and healthcare ethics. JAMA over the last decade has been producing the best of for that year of graphic medicine. So if you're interested in getting into the field, you can Google JAMA's best of graphic medicine and you'll see the last several years and some recommendations. And you can see here, this is Michael Green, and the other person on this is actually an EM nurse who started drawing when they started working in the ER and has since kind of made a career of this. And then the actual NIH, or the National Library of Medicine, actually created this exhibit, and it's a rotating exhibit now. And you can see where the exhibit is, but there's also an online exhibit that beautifully catalogs different kinds of forms of graphic medicine and different key works. They even have like a little bit of these educational resources where you can kind of even download almost like a syllabus to kind of help guide you or your students through kind of the field of graphic medicine. And it's actually a really great and visually appealing exhibition, online exhibition, but they're also rotating. I think currently it's at Harvard, but it's gone throughout the country. And so there's numerous different publications that have been coming out, both from the United States but also globally, just around this field. And there's a graphic medicine conference, and this year will be in Ireland later this summer.
So just to finish up with, again, a little bit more on the teaching component to it. While we've moved away from categorizing learners into like being auditory, visual, kinesthetic, like there's still a lot of support for understanding that the impact of presenting information or stimuli in different modalities can help the learner pick it up a little bit better. And so dual coding theory from the adult learning theory textbooks describes the application of processing stimuli in different ways and how that different representation can allow for sequential coding of memories and better knowledge retention and strengthens learning. So with graphics or graphic medicine, comics, images, all that, what's happening is that we're allowing the channeling of the visual component to strengthen provided text or information. And so graphic medicine in all of its various uses is harnessing this visual channel to reinforce learning. And if we look at the psychology of learning, so in addition to like the theory, the psychology of learning, we know very well that an affective component, an affective response will strengthen learning. And so whether it's that it makes us feel silly when we see something funny, we'll remember that a little bit better. Or if it's an image that tugs at our heartstrings because we can relate to a little bit better, we'll remember that. Or even if it's just that it's a provocative image and it evokes some guttural response, we'll remember that better. And so it's about bringing together that affective response with the images and text. And so whether as a teaching tool for trainees or instructional material for patients, maybe just reflective practice in picking up one of these novels that tells you the experience of the patients you take care of or the colleagues that we work with, we hope that you'll find a way to perhaps incorporate graphics into your amazing and awesome work that you're already doing. happy to take some questions, but also wondering if anyone has experiences themselves with graphic medicine. We'd love to hear those as well. Thank you guys for coming this morning. This QR code will have links to like the National Library of Medicine where you can get the tour dates. I think it just started this past February or January, so it still has another full year of touring with that. It links to graphicmedicine.org, which is where Dr. Ian Williams and the rest of the collaborative created the field, and then it has materials in it as well. Yes?
So I think this is awesome, and I'm excited to do more of it. But do you have advice for people who would love to create things but don't actually have any artistic skill?
Yeah, no, absolutely. So I think with the interest, so the question for the recording was for people who may not feel comfortable with drawing or imagery, how to still incorporate this into the materials they might use for teaching or others. There are, even in the QR code, there's going to be a link to some pre-made images that can be used openly, but that the website actually helps you create storyboards, and then you print it out as a PDF, and then now you have the comic book that developed from it. There's, again, it's not about being Monet, but like the weird Picasso-like figures can work too. So using any type of open AI software now that can create the images for us, I've started to use that as well. And then things like the Noun Project, which give you black and white, simple clip art images that are open use as well. So there's definitely ways available to incorporate images. It's not just about you drawing it, but I think creating the story around it and using the image to your benefit, yeah. So there'll be a couple links on the, and even the National Library of Medicine one links out to like other, if you want to learn more, here's a course you can take online and things like that.
A little bit tangential about the visual part of this. Do you have any comments about mind mapping and kind of putting notes together? You know, it's how people kind of learn and visually just kind of put stuff together and just see like patterns or something. Do you have any comments kind of related to this practice?
Yeah, I think that, again, when we did away with like the learning theory of like just being like a visual person, I think that there's a whole world of how adult learners require just a little bit more, right? There has to be like an investment in it. And so like with mind mapping, my understanding is that you're utilizing a little bit of the dual coding, but it's about the connections, the neural connections, and so a lot of it comes down to like social, right? So like you have a social component to it that can help. The affective response to it can help. It's about making it relatable and approachable. When we feel very standoffish, we can't find ourselves in that field. So I haven't read too much directly on like the mind mapping in this application, but I think there's a lot of overlap in the theory that would go behind it. Thank you, everyone.